Hello students. Okay, this is the most important question in clinical psychology. The question is, what is schizophrenia? Schizophrenia. Uh, we can understand this schizophrenia in these 5 points. Like one is, this is the group of many psychotic disorders. Okay, in this one disorder there are many psychotic disorders. So this is a group of psychotic disorders. Then second is victim. The person have some personal, social, and occupational life is totally affected due to disturbed thought process. Okay, so the persons who is his personal life and social and occupational life is totally affected by his disturbed thought process. The person think differently. Okay, then third is strange perception. The person, the victim of schizophrenia, have some kind of very different strange perceptions. Then fourth is unusual emotional state. The person may show his emotional state which is not appropriate to the time. Okay, then five is motor abnormalities. We can see many motor abnormalities in the person who is affected by schizophrenia. Okay, the in examinations the examiner may ask the what are the symptoms of schizophrenia. तो जो symptoms of schizophrenia है वो we can divide it in three types. First is the positive symptoms, second is the negative symptoms, and third is the psychomotor symptoms. Okay, तो ये जो पॉजिटिव सिम्टम्स होते हैं ये क्या होते हैं? पॉजिटिव सिम्टम्स में होता है एक्सेस ऑफ थॉट्स, इमोशंस एंड बिहेवियर. एक्सेस ऑफ थॉट्स, बहुत ज़्यादा सोचता है, बहुत ज़्यादा इमोशनली फील करता है, बहुत ज़्यादा वो बिहेवियर करता है विच इज़ नॉट अप्रोप्रिएट. देन नेगेटिव में ये सब चीज़ कम हो जाती है. लाइक डेफिसिट्स ऑफ थॉट्स, इमोशंस एंड बिहेवियर. द पर्सन मे बी डेफिसिट्स और मे हैव डेफिसिट्स ऑफ थॉट्स, इमोशंस एंड बिहेवियर. ओके, इसका अपोजिट नेगेटिव सिम्टम्स होंगे. तो आपको ये ध्यान रखना है, पॉजिटिव में एक्सेस ऑफ इमोशंस, थॉट्स एंड बिहेवियर होता है, एंड नेगेटिव में डेफिसिट्स ऑफ थॉट्स, इमोशंस एंड बिहेवियर होता है. देन थर्ड आता है साइकोमोटर सिम्टम्स. साइकोमोटर सिम्टम्स में उसके जो बॉडीली सिम्टम्स हैं वी कैन फाइंड आउट और वी कैन सी that there is something different or something abnormal as compared to the normal person. So these are the symptoms of schizophrenia. और इसके जो other symptoms हैं we will talk about this. Okay, then just note this. Okay, the schizophrenic person can also develop some delusions and some hallucinations. So what is the delusion? Delusion is the false belief that is firmly holds inadequate ground. Okay, the person who is affected by schizophrenia have some kind of false belief, right, which are holds on inadequate grounds. They are means his beliefs are not have some kind of firm ground. That is, we can divide it these delusions like delusion of persecution. Means the victim of schizophrenia may think that he is under plot and under spied on and may be attacked by some other person. Okay, so the person who he thinks that he is more prone to in danger. Then second is delusion of reference. Means the personal meaning to the other section. He always think that another person have some kind of work or some kind of action, they are totally for his harm. Okay, then next delusion is delusion of grandeur. Means especially empowered like God gifted. The person think that he is well powered by God. Then delusion of control. It means that the person thinks that his thoughts and actions are controlled by the some other third person, or we can say the other person, right? Then what are the hallucinations? Hallucinations are the perceptions that occur in absence of an external stimuli. The person who is schizophrenic may have some kind of perception which which occurs at the absence of any external stimuli. Means वहाँ पर कोई ऐसा कोई external stimuli नहीं होता है, लेकिन the person feels some kind of have some perceptions like tactile hallucination. Okay, then somatic hallucinations like for example, the person feel that there is a kind of a problem in his stomach, but if we have some medical uh, examination of his stomach, then we cannot find any problem. Okay, then visual hallucination, the person thinks that he is seeing, or he is able to see some other things which are not visible to others. Okay, so then gustatory hallucination and olfactory hallucination. The person thinks that he has some kind of smells, or he is he has developed some kind of bad taste. So these are the hallucinations, and these are the delusions. uh, Apart from negative, positive, and psychomotor uh, symptoms, we also have some these delusions and hallucination in schizophrenia. Okay, then in negative symptoms and motor symptoms, we will also have some points we will discuss in next video, or in this after this video, right? So till then, please note this: